millions of Americans are newly insured. Now we have to make sure that the care is there. Our health system is changing rapidly. A health center, a hospital, a home care agency, a nursing home will have to work together seamlessly with a focus on the patient.
The population continues to age. Our goal at the Parker Jewish Institute for Health Care and Rehabilitation is to ensure that those people can live healthy in the community, age well in the community.
Did you have any pain when you did that?
No.
We own and operate a 500-plus bed skilled nursing facility. We have a multitude of community programs, which include medical model adult daycare, social model adult daycare, home care. We are also one of the founding members of AgeWell New York, which is a licensed managed long-term care plan, which services well over 2,700 members and continues to grow each month.
All those things that the team is talking about is documented in here. So we take this and we formulate your plan of care.
The goal is to make sure that each individual has their own care manager who is part of a care team at AgeWell. We want to keep that person healthy in the community. We want to avoid hospitalizations.
And obviously, whatever they did for you there worked and got you to where you are today.
Yes, I am. Yes.
PCDC, it's working in tandem with providers such as the Parker Jewish Institute to ensure that the primary care, literally the attending physicians in the community, are focused upon working with the nurse supervisors, working with the care coordinators, the care managers. So when they talk to the family about mom who's 90 years old, they have the most accurate information available.
Thank you, thank you, thank you.
All right.
We can improve outcomes, we can improve the health of communities, and we can reduce costs. But you can only do that by building strong primary care.
The Institute for Family Health is focused on bringing state-of-the-art healthcare to low-income communities. They're really community centers that try to deal with a broad spectrum of issues that people face.
Heart disease, diabetes, obesity, those are major issues in our community. People feel comfortable coming here. They feel the people that serve them care about them, and it's providing a wonderful service with all of the things that help to make for quality health care.
When you look at buildings like this, beautiful, modern, attractive, it's a testament to the respect for these communities and for their patients. And it's not just facilities, it's the way that care is delivered that respects the patient, that knows that the patient is the most important partner in their care.
Good boy.
People come to them instead of them having to go to 15 different places. And you're open 105 hours a week instead of 40 hours a week so that you can fit services into when the patients need services, not force them to get services when you're open.
All right, you were here earlier this week, and she was sick.
Yeah, she was.
How is she today?
She's much better.
Yeah?
Yeah. I'm always in communication, even texting, emailing on my phone, the app, and I can check if I have any upcoming appointments or my past visits here.
Take a big breath for me.
Honestly, there's like no other place I will go to. Everything is there for me.
Can I look at your ears still? Okay. A patient-centered home means that when they walk in the door, they have an assigned provider. And there's a multitude of people that see you and try to help you with your health care needs.
Some of the over-the-counter medications that he might be taking. I came to the Institute as a medical student when I was at Mount Sinai. It opened my eyes as to the mission and what I would need to learn in order to provide care in communities of need.
We and the Institute share a commitment to take care of the most vulnerable populations in our community. While we're training the best neurosurgeons, the best geneticists, the best cardiac surgeons, we also need to train the best primary care providers.
You hear that? What's it sound like?
A monster.
Like a monster.
The Institute and PCDC have been partners in developing primary health care. Together with PCDC, we built this incredible facility in Harlem that is just a showcase. We'll be back to PCDC to work with us because they've been incredibly creative and innovative.
PCDC's mission is to get good, effective primary care into low-income communities. We offer capital financing for new and expanded facilities, new equipment, modernization.
So the change team is very clear about what happened in their group visits.
We provide assistance in changing how care is delivered so that it's team-based, patient-centered, coordinated care. We help policymakers understand what's involved, what's needed in order to support good, viable, effective primary care.
As we move into a world in which the management of the patient and his or her healthcare needs is critical, the primary care providers play a central role in that.
Does that primary care physician in the community have the total picture of that resident? We need to look at the entire patient holistically to make sure they're getting all the right services at the right time.
In our primary care model, there's nothing that we kind of see outside the scope of our concern. It's what we mean, I think, by patient-centered medical home in its truest sense.
We believe that the health and well-being of the community demands a genuine and sincere effort to do everything that is possible in order to improve the circumstances of a community.